what you say we've seen is just the first wave of infections and a secondary wave of infections is coming. Help us understand what the secondary impact is going to look like.
I think it's important to know that currently what we're seeing in parts of Europe and in America really reflects the situation from the first wave. When we talk about the second wave, it is what happens after countries are able to contain the current situation, which is what countries like China, Korea, and Singapore have done in the early parts of March. We managed to contain the situation, but because the world epicenters still remain, there will be risk of importations, which is what we're seeing in Singapore right now, which is similarly what we're seeing in China. They have very limited domestic cases, but a lot of their transmission now is coming from overseas. And this is really the fear for what will be seeding the second wave, that countries that are still suffering the brunt of the coronavirus infections will be exporting people with the virus, especially as people who are citizens of countries are returning back, like what we're seeing in Singapore. Our second wave was triggered essentially by Singaporeans who are studying overseas, who are working overseas, but because of the global situation, they have chose to return to Singapore, and a fraction of them come back infected. Over to you.
So what do we need to do to mitigate some of the impacts of this likely secondary wave? Do you think that it's likely we're going to see airports being closed for much longer, the social distancing and restrictions that are now in place across a number of countries around the world, perhaps sticking around for longer as well? Are there other things that we can do to reduce the likely impact of this incoming wave, as you put it?
So then you have raised two very good points. And the first point I will repeat is really around understanding where people are coming from with the disease. And this is where having specific and prudent travel advisories and travel bans will be necessary to limit the risk of further imports into countries. The second really is there will be local transmission, and what do countries do to manage the local transmission? And it will have to be encouraging greater physical distancing, like what countries in the European countries, in Singapore, we have done. And in addition to physical distancing, the very traditional public health measures, such as contact tracing, identifying where the infected people are, who are the suspected cases, isolate them early and quarantine them early. Those principles must remain at the center of countries' response to the coronavirus. Over to you.